Okay, we are ready to go now, sir.
Okay.
Yes.
So good afternoon, everyone. Thank you so much for taking out time this afternoon to join us. So this is an initiative by UP to help motivate young researchers towards more and get them more research oriented. So keeping that in mind, with us today, we have Professor Mandava Prasad, who is a very well-known research-oriented professor from India. And just to give you a brief introduction about Professor Prasad, he has a total teaching experience of 23 years. He is presently working as the professor and head of the Department of Orthodontics and Dentofacial Orthopedics at Narayana Dental College and Hospital, Nellore in Andhra Pradesh, India. He has formerly been a Dental Council of India inspector. He has also served as an executive committee member of the Indian Orthodontic Society 5 times. He has delivered guest lectures at various national and international conferences organized by both the Indian Dental Association as well as the Indian Orthodontic Society. And Professor Prasad currently holds life memberships to the Indian Orthodontic Society. He is a fellow of the Academy of General Education, fellow of the Pierre Fauchard Academy, International College of Dentists, a fellow of the World Federation of Orthodontists. He's an international member of the American Association of Orthodontics, a life member of the Indian Society of Dental Research, and also a member of the International Association of Dental Research. So keeping that in mind, I think this should give you a brief idea of how vast his research experience is. So without further ado, I would like to request sir to start the lecture for today, please. Thank you, sir.
Thank you, Anand. Thank you so much.
Yes,
Am I audible? Am I audible?
Yes, sir. So very clear, sir.
Yes, Anand. Thank you so much for the wonderful introduction. And it is my privilege and honor to be presenting the first of our mutual MOU between Narayana and our University of Putisastra. I feel very happy. So to start with, very good afternoon. We are already into the afternoon. Very good afternoon. Just hang in there. Just don't move around because this is a topic which is a different topic, not a clinical topic. So you should hang in there and enjoy this movie. So the topic today is the research in dentistry, a paradigm shift. So the paradigm shifts, all of you must have heard a lot of times during your whichever specialty you are, you must have heard a number of times about this paradigm. We will get into the details. So I would like to thank each one of them here, the president and the vice chancellor, Dr. Findlay and Dr. Callum, the dean faculty, Dr. Ajay, Dr. Shivakumar, the dean of Narayana Dental, and our beloved chairman, of course, smiling is Dr. P. Narayana, our president and chairman, founder chairman, of course. And I will be failing in my duty if I don't thank this man, Anand, and everybody knows what work Anand is doing. And with this twin, of course, I'll talk about that later. The twin means twins in research, Anand and Adit. So great work, Anand. I'm so happy for you. And a little about me before we go into today's topic. So I started my career at Manipal, and this is where I landed up now. The last 16 years, I'm here. And you see there in the circle, we are close to Chennai, in the south of Andhra Pradesh, close to the Bay of Bengal. So, and thanks to Corona, somehow I moved into the final year of my PhD. And I don't know how many will thank Corona. And I really thank Corona. So many things have changed for me. And many of my friends have told it has really helped us. And of course, let us not forget about the disaster, it has created. And it has, all of you know, the world of webinars. We are into the world of webinars, starting from the LKG student to the whatever PhD, whatever industrial, wherever housekeeping and family webinars, family get together, everything is in this world, the world of webinars now. So this is the new trend which we have to accept and move on, and all of you should be careful. And the background for today's presentation is, so as I was going to the University of Sastra website, I found this very interesting, and I had the same feeling like Mr. Bean. I was really surprised to see the syllabus. You see here the 7-year, the BDS foundation, the course is for 7 years along with the internship, and you have the thesis also, the practice management, and of course, and today's topic is also there. You see the research methods and biostatistics. So it is really good that such a good syllabus is there in the University of Sastra. And to the coming into the today's, before I get into the lecture proper, the today's lecture, this I found interesting in one of the Indian Orthodontic Society webinars, and this is very true. Research has found that there is the shrinking jaws, whatever is the reason, the sedentary life and the industrialization, whatever you can see there, the primary response to the environmental changes. Now there are lots of problems. Now the jaws are getting smaller and the teeth crooked and crowded. Yes, that's good news for the orthodontists, as we are the specialists, and we are happy. But still, and as a dentist also, there are a lot of issues coming due to the jaws getting smaller. Okay, this is an excellent book where you will find the facts. This is a scientific fact. Keep this in mind, and as we go in, you will see more of it. And finally, all because of this, it leads to the obstructive airways. Okay, so you have the OSA, the obstructive sleep apneas, and so you need to take care of so many things now. Not just the dental part, not just the intraoral part, not just the cosmetic and aesthetic parts. So that there is paradigm shift, of course, there is in the dentistry, and we need to get used to these paradigm shifts and the practice during this pandemic. So there are many questions regarding, of course, the infection control and the sterilization and monitoring of this during the pandemic. We need to take care of all these things. And so now we can see this article, you see the oral health and COVID-19, the increasing the need for prevention and access, you can see. So we moved from the aerosol generating procedures to we shifted to the more towards the non-aerosol generating procedures and preventive procedures. Even now we are scared to blow the three-way syringe. So that is the situation now. Now it has slightly improved now in South India at least. That's what the TVs and the media says that. And so the paradigm shift, this has all affected, and we have shifted. The paradigm shift is there in the dental education, and even in the research part also there are some limitations now. So the clinical areas, so the COVID-19 pandemic has taken the world by surprise. The article says surprise, no, what this man is telling is true. It's shocking. Okay, it has we all know how many of our families are affected directly or indirectly, so it is really shocking. And but we have no other choice to move on with this, and by taking all precautions. And there are paradigm shifts in our specialty also. This is one of the articles. So if you knew what we were doing, it would not be called research, would it? It's definitely not. So the research is also, it is fun and it is hard. Okay, so the research side, you have fun as well as, and you need to be more systematic and more organized in the clinical research areas. So the research is searching again and again with evidence. Okay, so the evidence-based decision making in dentistry, that is now has come the to the mainstay, and for the use of our whenever we talk about our patients, it's indirectly it will reflect on our patients. Okay, so the patient is very important. Whatever research we are doing, it should be of help to the patient. So we are in this evidence paradigm. So people lie, the evidence doesn't lie. That is what this evidence-based orthodontics can see here. So the paradigm shift. What is this paradigm? I will just briefly tell you. There's a different, distinct set of concepts, theories, research methods, and postulates and standards for what constitutes legitimate. Okay, so it is legitimate contributions to the field. It should be accepted throughout the world. There should be acceptance throughout the world when there is a paradigm shift. Okay, this is the man behind your paradigms. You can call him the father of paradigms, Thomas Kuhn, the father of paradigms. He's no more. 1922 to 1996. He is a PhD in physics, but best known for his theory of paradigms. So the paradigm shift, the concept was identified by the American physicist and philosopher Thomas Kuhn, which I showed you just now. So he explained the paradigm shift as a fundamental change in the basic concepts. Okay, so the basic concept will little bit of change and additions will be there. Research is progressive, as all of us know, and according to Ackerman and Profit, it is a universally accepted scientific perspective. The best current explanation of a natural phenomenon has been termed a paradigm. So this is the cycle. I will not go into the details given by Thomas Kuhn. This is not our topic, but I just wanted to make sure that you know what is a paradigm shift. So the research you see here is creating new knowledge, and you see I'll give you a couple of 2-3 small examples. You can see the Jackson stride. All of you know, the dental students will definitely know this. Though, so that was the initial the Jackson stride, and you can see there how there is the modifications of your Jackson stride and finally affecting your airway also. Earlier I have told you the shrinking jaws. Keep that in mind. That has an effect on your airway. Okay, so there is evidence. There is lot of evidence. Okay, your constricted airways, and you need to focus. And you have a specialty airway focused, the orthodontics or the airway focused dentistry. So that has to be kept in mind. So this is how your Jackson stride has modified. And you know the future is your patient reported outcome measures in dentistry, orthodontics, and all the specialties. Okay, and also in the future you will see the oral health related quality of life. If you type oral health related quality of life in dentistry, you will get thousands of articles. You can just go through the thousands of articles in all the 9 specialties. So the quality of life is the main goal for our dentistry is to the enhancement of quality of life of the patients. Recently, we have published a systematic review on the quality of life in orthodontic patients. So the quality of life, this is the modern healthcare paradigm. This is the current shift, the quality of life, the oral health quality of life. This is the current paradigm shift for all the young budding dentists. So the impact, the oral health related quality of life in children. Okay, so the time for a paradigm shift even in your Jackson stride, it is being modified and articles are being published. Shortly, we will see the new Jackson stride very shortly. So the research you see is creating new knowledge, and you see another example. You see the Ackerman Profit classification. You see this was the, you see the article, the AJO 1969. This is how it was with the 9 types. You see there 9 steps. You can see there. So how this was modified, you can see there. The pitch, roll, and yaw are also included here into this Ackerman Profit classification. This is also the research is how it is progressive. Then you can see what happens to this Ackerman Profit classification. The AO Congress, Washington DC, 2018 AJO. You can see here how the current Ackerman Profit is classified into the 4 categories. You can see there: corrective, camouflage, oral surgery, and adjunctive. So this we can call a paradigm shift from there to here. You can see how it has modified in the past, 70 and 2018, you have seen that. So the new knowledge is put in, and you can see now the Profit and Ackerman in 1994. All of us know as dentists. You can see the envelope of discrepancy. There were 3 steps only initially. How it has modified now. See, this is the current this one, the 2020. The new articles have been published. The 4th envelope, you can see the 4th envelope is, sorry for the picture quality, you can see there. The 4th envelope is the tags or the skeletal anchorage is included. The green one, that is your 4th envelope now. So this is the modification now currently. You can see the current concepts of your orthodontic discrepancy stability. Okay, this is the article, and this is the recent one you see here, the Journal of World Federation, the 2020. So the envelope of discrepancy we revised in the era of the 3-dimensional, as we are into the 3-dimensional imaging, and we are into the so many that the 3D digital printing. So many things have come in, and even we have now the artificial intelligence into the dentistry, and already there's a lot of studies are there. The artificial intelligence in orthodontics in our specialty, and even the various specialties, and also nanotechnology is also now the incoming thing. So as Dr. Graeber says, do not sit back and wait, just investigate. The great man. And so the systematic search of the pertinent information on a specific topic, that is called research. So it keeps on adding. The research cycle keeps on adding. This is how the research goes on. Doing research, publishing. So you need to publish. We'll come to that in detail. Publishing and research. This is the systematic investigative process. Yesterday, I will share with you one thing. Yesterday, one of my students walks in yesterday morning. Young boy, he's a house surgeon. The BDS he has completed. So he says he walks in a hurry. Sir, I want a publication. Publication. Can you put publication? Can you add my name like that? Then I told him, please, you attend the lecture tomorrow morning. Then all your doubts will be cleared. So I hope he is there in the attendance, the delegates list. So the research never stops. Okay. So the wheel of research. So the publications, I will talk to that later. So you have the basic research, then you have your applied research. So the quality, these are all this you should keep in mind. The young students, even now the things have changed. The research is fully blown out of proportions. The world at your hands. Everything is in your hands. Everything is in your gadgets. So you need to focus more, and you need to shift to this research. As you enter the clinicals, you should stop doing. You should start doing small short studies, even at the UG level. Then only you will be updated with the current scenario. So the world, you can see there, you need to get updated each time. And you see here the pyramids. There are lots of pyramids. I just want to go through this. You see this, the evidence-based, the pyramid in dentistry, the evidence-based, you see that the top. So the evidence-based clinical practice guidelines, that is at the top of the pyramid. You can see there. Then the expert opinions are at the base of the pyramid. Okay, expert opinions, we cannot consider it as concrete. So that is why the clinical trials, the systematic reviews, meta-analysis, and the evidence-based clinical practice guidelines, these are at the top, and which will help our patients. Futures, these are the various pyramids. Let me not talk about all this. And you have the Cochrane also in the top of the pyramid, the Cochrane. This is Professor Archibald Cochrane, 1909 to 1988. Professor Cochrane has done a lot for the evidence, for the research. So Cochrane review is also very important articles and the quality. It tells you about the quality of the research. So this is one pyramid. You can see that the recent. This is also recent article. You see there the qualitative research. The level 1 you see again, as I told you, the systematic review, meta-analysis, the RCTs. Okay, the well designed, the controlled RCTs. Then you have the evidence-based clinical practice guidelines also. Then you have the NICE guidelines, the National Institute for Health and Clinical Excellence, US. You can see there the NHS, the social care, the NHS and the public health. So the NICE guidelines is for quality standards, to develop the quality standards. So the Institute of Medicine defines quality of care as the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. So you can see, if you see the framework of quality, you see again all these things, the steep guidelines, you see the patient-centered. Everything is patient-centered. So the quality measurement, coming to the research, the quality measurement, you see there, what is the citation data, the bibliometrics. This was given by Eugene Garfield in 1995. The bibliography, it is just an orderly list of resources on a particular subject. Okay, so this we can leave here. The alt metrics, yes, these are all based on the various where the WhatsApp or Instagram, Twitter, all these areas. This is called alt metrics. That is a separate topic. So that is also called the non-traditional metrics. The alt metrics are views, downloads based on the views, downloads, likes, shares, tweets. All these are your alt metrics. Okay. So the bibliometrics, this is very important. The bibliometrics given by Pritchard, the quantify process of written communication. Okay, so the bibliometrics, you can see the bibliometrics. These are the 4 bibliometric indices, which is very important. This we will go into the slide detail. The H index given by Hirsch, I'll show you that also. The SNP and the SJR, the scientific journal rankings based on the scientific journal rankings, and you have the type of journals that I will also tell about that. The Q1, Q2 journals. My dear friend Anand is addicted to publishing only in the Q1 and Q2 journals. That is a excellent work he is doing, Anand. Congratulations once again, Anand. So we can see the orthodontic journals, and I'll show you the dentistry journals also based on your H index. So the bibliometric study of the 3 journals and the articles, the citation impact, the H index, G index, and the journal impact factor. So Hirsch in 2005 has given this H index. Most of us know what is H index, but who has given this? The Hirsch has given this, and the I-10 index, it is nothing but publications. If your publication is cited with the 10 citations, that gives an I-10. Then the Google Scholar citation data has a far broader range. People are a little confused. I'll tell you about that. Google Scholar, the PubMed. So, and it is a large area, this Google Scholar, and you get the citations are more due to whether the textbooks or articles, various articles, all these things. So there is a confusion, the which one to search. And this article you can see there, PubMed searches and Google Scholar searches often identify different articles. In this study, the Google Scholar articles were more likely to be classified as relevant, had higher number of citations, and were published in higher impact fact journals. So this is what this study says, you can say. So both are equally good, and you can focus on your Google Scholar. I'll tell you how you should first register to all these quality, all these sites first, then only your work will be noted. So the G index, this is based on the publication record given by Leo Ege. and the hers. I will tell you about that. So sure. Then touch namkada. I'm sorry, just 1 minute.
Yes, sir.
Yeah, sorry about that technical glitch. Anand, it's clear, Anand? Anand,
Yes, please, sir. So it's fine, sir.
yeah, I can continue. Yes, yes.
Yes, please, sir.
So the H index, this is Hirsch JE. So wonderful work by this man, bringing out all the individual's scientific research output he has given. The purpose of the H index defined as the number of papers in the citations number greater than or equal to H as useful index to characterize the scientific output of a researcher. Okay, so this is very useful for the university faculty recruitment and advancement and awards and the grants. It wherever, and even in future they will ask you what is your H index. If you go for an international conference or national conferences, they will ask you. They will ask you only how is your H index, how is your Scopus, how is your Publons, how are your reviews. This is going to happen in a very short time. This is an example I can just tell you. So you need to register in this Google. You can see the Google the citations are more and the H index is also high. And then the Researchgate you can see the score and the H index will shoot down as you move towards the quality areas, the Researchgate, the Scopus and the PubMed, it will slightly move down. Okay, then you can see here you need to you can observe here the H index excluding the self citations. Okay, so self citations should be limited unless and until it is very closely related to your research. Then you can cite your work, or else you need to minimize that. That is slightly minimal in our specialty. That's what this recent article says by Nicholas Pandis, is a very famous author, Nicholas Pandis. So you can see here. So the ORCID, I'll tell you this, without ORCID, we will not be able to upload the publications in a quality journal. That is very, very true. Recently, as I was uploading one publication, so a couple of my pages didn't have the ORCID ID. So we had to, without that, it has rejected. So then again, we created the ORCID IDs and then we uploaded the article. Then you can see the Scopus here. The Scopus, there is drop down newer H index, of course. This is a quality based, and mainly also you have mainly. Then you have the Publons. You can see still there is a drop in your H index. So these are all the quality based websites where you can upload your research. The Web of Science, you can see this is the current research site. You can see there it will give you a full 360-degree view of an author's work, the author's metric, and you can the core collection. You can see it is a trusted, high quality journals, books, and all. You have the conference proceedings, and there is so integrity. We will come to that later. The integrity is very, very important. So integrity, publisher neutral, in-house curation. So these are the various. So the quality, you need to focus on the quality. So you can see here, you see the Q1, Q2, Q3, Q4 journals. So you can see according to their position, the Q1, the top positioning journals, and Q2, the mid upper positioning journals, then the Q3, mid lower positioning journals, and you have the bottom positioning journals, the Q4. Okay. Beyond that, even if you publish, it is just count sakes. You can publish, but you will not have much satisfaction. So we need to aim for the at least till the Q1, Q2, Q3 journals. So the call based on, forget about these formulas. I just wanted to tell you what are these Q1, Q2, Q3, Q4 journals. And of course, our twins in research, Anand and Adit, they are addicted to the top two, the Q1 and Q2 journals. Good, really great work they're doing in various aspects, not just only our specialty, and they slightly expanded their research in different areas. So the journal H index here, I want to, this is a good point. You should keep it in mind. The journal H index, this is our journal, orthodontic journal, the father of orthodontic journals. This is this. Now the H index is 150. So the angle orthodontist, now can see there. The angle orthodontist, you can see the H index. So these are all being an orthodontist. So the SJR is very, very important. The SJR calculation, okay, the snip ratio, and you see the angle orthodontist, you can see there the AJO. Now it is 121. These are all. This was taken little earlier. So the current, this was taken yesterday. I got this for you. So these are all the dental journals, dentistry journals. If you see in the top 15, I feel a little bad also. But in the top 15, you don't find an orthodontic journal. Okay, but orthodontic journals are there in the top 20. That's one good news for us. So that there are various reasons for that. That is because of the SJR and the SNP and the wide range of articles. The dentistry journals have more scope and more area of publishing. You can see. So these are all the top 15. You can see there. So our department, I'm happy to share with you our department work is shared in all the Q1 journals, almost all the Q1 orthodontic journals. So it gives a lot of satisfaction for us, our department, with Dr. Gauri Shankar, my dear brother, and my other staff, Dr. Vivek and Dr. Aparna. So you should be careful where you collect your evidence-based articles, not from these sites. So you need to first, the take-home message which I'm giving you now is, the first one is unlock your research, register and upload your work. A large percent of work is unpublished. So the register now on all these various sites. Okay. So register now. Some of my postgraduates have registered, and I can see their names now and then. I see their names popping out. That's a good sign. So all these sites you need to first register through using your email. You can easily register, and whatever publication or article you have, you can upload here. So then you can see it growing. So the research integrity is just being honest. So that is very, very important. So publishing is very, very important. So publishing is your work starts. That's the basic responsibility towards society. All the good work which you do, you need to publish. Otherwise, it is of no use. If you don't publish, your research is as well as not done. So no point doing such good work and leaving it aside on the table. So the professional advancement metric for promotions, the grant applications, research funding, all this, it will help the research as so much uses of advantages in the now currently. So the integrity, all of you know, I will not tell you much on integrity. The research ethics, you need to follow the research ethics and follow the integrity. This is one thing you should not be doing here. So internet, you need to take out what is necessary, and you need to, okay, you can take things from there, but you need to again modify things according to your area of research and rewrite. So history also says there is misconduct, research misconduct. So the research, so the ethics should be followed, ethics and values. These are different articles. We're reporting the ethical issues, the clinical trials, the ethical issues. So the public, so the research integrity is very, very important, and most of the institutions now, they have the IRP and the IEC, institutional review boards, and the institutional ethical committees, and the proper forms are now. We are also following stringent measures in our Narayana Guru institutions also. So the plagiarism, this is one we need to avoid plagiarism. And the ethics, the levels of plagiarism is also important. So without knowing, unknowingly, unintentional, it may be intentional or unintentional sometimes. So you need to be very careful. You have all the softwares now. You can check the plagiarism issues. What issues can arise? You can see there. These are all the issues. Let me not go into the details of all these things. So you can wrong observations and undeserved authorship. You cannot just give authorship to anybody. So we need to keep all this in mind. Yeah, there should be substantial contribution from a person to claim the authorship. That is the important thing. So unintentional, intentional, as I told you. So when you are able to maintain your own highest standards of integrity, regardless of what others may do, you are destined for greatness. Okay, so you need to stick to integrity. All of us, the institutional review board and the board activities, of course. So the integrity, intelligence, and energy. And if they don't have integrity, the other two will kill you. That's an excellent statement from Warren Buffett. So we need to focus on improving integrity and quality of the institutional environment or research. So there are so many, the Irish national statement and the national policies, all based on the focused on the integrity. And we have the Dental Council of India at India now again with the stringent measures now, which has given some guidelines on the research integrity and the plagiarism. So let me not tell you all this. These are the different methods used for measuring the progress of the integrity. All these are various methods used for focus on the integrity in the research. So as we move towards the tomorrow's challenges for the science of orthodontics and the dentistry, and we have time, money, and so the evidence-based practice in the orthodontics and the dentistry, and now we have the evidence-based dentistry and the translational research, the journals I've shown you earlier. The translational research is the interdisciplinary field of biomedical research. So the different branches of dentistry that aims to reduce this gap by advancing methods that are shown to be effective in moving high quality scientific evidence. So the high quality scientific evidence. So the 5 A's of evidence-based practice. This should be our aim. The evidence-based practice. Follow the evidence-based practice guidelines to assess the patient. Ask the clinical questions. Acquire the best evidence. Best evidence from where you will get from the quality journals based on your H index. So the Q1, Q2 journals. So acquire the best evidence from them and appraise the evidence and apply the evidence-based patient care. So now most of our students, we ask them to, if the clinical case is there, we ask them to get the evidence article pertaining to that that patient, the problem with that patient, and so we then only we allow the student to touch the patient and do the work with proper evidence-based articles. So this is what this is how it is useful. The research is useful to for the patient's benefit. Whichever research we are doing, we need to use the highest level of evidence, the clinical interventions combined with the, so that is very, very important, the evidence for the public health and for the patient. So the quality of care we will provide for our patients in future. These are the various types of research, the objective based, approach based, and precision in final based research. Then you have the, as I told you, the translationary research, the benefits of research beyond the academia, and the quality of life. I told you, the current paradigm shift, it has moved the quality of life. Previously it was the soft tissue paradigm, but in the orthodontics, like the same way, the various branches, there are different paradigm shifts. The oral health, pain, the OHR, QOL, oral health related quality of life, you can see there, the oral health pain, the bleeding gums, then you have the social, emotional, and you have the functions, then you have the treatment expectations. Treatment expectations, these are very, very important. Lots of studies are being done in the European dentistry journals and the various journals. You can see there the treatment expectations by the patient. That is very, very important. So the scientifically based research standards, there is you need to apply rigorous, systematic, and objective methodology. So the precision orthodontics, you can see. So it is the evidence-based dentistry, okay, and evidence-informed decision making. All is focused towards our clinical cases, the patients. So the quality, integrity. So what I would like to say is today, the carry home, you can see there, register your work on all the quality websites which I have told you, the Google, the Scopus, the Researchgate. Researchgate is a very wide area, and we keep communicating in the Researchgate every week, 2 3 times. We keep communicating. So it is such a vast area, and you can improve your academics, and you can be updated with the current research in the various branches of the of dentistry. So then you need to focus on the evidence-based journals. You need to go through the journals, then the patient-oriented research, the current research on the patients. So thank you so much for your patient hearing. So all of you be safe and stay healthy. And so this, my family. These are the couple of recent photographs with my daughter and wife. And my extended family, our team Ortho, my Dr. Gauri Shankar and all my dear postgraduates, and they keep helping me whenever there is a presentation or some articles or whatever I ask, they just immediately push it into my email. So that's how I could make such presentations, and thank you, all of you, dear Ortho family. So I dedicate this presentation to all the budding dentists all over, all who are here, and even those who are not here also. So dedicate this presentation. Thank you so much, dear friends, for your patient hearing. So let us keep caution and wear our masks and maintain social distance. And it's still not over it. Stay safe. Thank you so much. Thank you, Anand.
Okay, thank you so much, Professor Mandava. Thank you so much for such a great presentation. I like how you
Thank
put
you, madam.
all the good articles so the participant can, go learn more in such a broad spectrum lecture, and I'm sure everybody will go and search on their own. Doctor, now that we are finished, can we move on to the Q&A session, sir?
Yes, madam. Yes, madam. Please.
Okay, so if I okay, so the first question is, thank you so much, sir, for your excellent presentation. So can you
Thank you,
suggest
madam.
any free software to check plagiarism?
Software, madam.
Software to check plagiarism, sir.
Yeah, yes, yes. Madam, the software. There are so many softwares available on the various websites. It is there, madam. Some you need to purchase these softwares, and some of the softwares when you publish, when you upload in some journals, the publications, there in their site itself, they give the links to check the plagiarism of the articles, and then we can correct the plagiarism and again upload. Sometimes without checking the plagiarism, if we upload, which we recently had one experience, and even though it was limited to only 22% of plagiarism, but still they had sent it back, and that too, the plagiarism was not in the main article. The plagiarism was in the references. The references, it was shown more. So still it was sent back, and we, from the website itself, we modified and then again re-uploaded. Then now it is going on in the peer review.
Oh, I see, sir. So in University of Naravayana, do you have your own plagiarism checking software, or you use the online one, sir?
No, madam, we have some of us, we have bought the main other plagiarism checking softwares we have bought. We don't have actually our own this plagiarism softwares here. Yes.
Okay, sir. So if I may follow up on the question, how many percentage of plagiarism is considering acceptable? So because if we duplicate the study method, I'm sure there's going to be some plagiarism involved, isn't it?
Yes,
because
madam. Yes, madam. Yes.
Yes. So how much plagiarism is considered acceptable in the field of research, sir?
Madam, most of the journals, it is around 10 to 20%. They don't mind, madam. The between 10 to 20%, it is acceptable, this plagiarism. And so beyond that, some journals, they start questioning you and they will send it back.
I see. Thank you so much.
Yes,
So yes, for the next question is from Professor Kolong. He asked, if the student do not know what topic to choose for their research, what should they do? How can they find a topic?
Yes,
let's say for the thesis.
Yeah, definitely. Madam, they see any student, see all of us are students and we reach till here, and any student, he should go to his guide, his teacher, whoever, and his area of interest. Based on his area of interest, he need to approach that faculty, that professor. If suppose in your institution, if somebody is interested in orthodontic materials, then he need to contact our Maria, Professor Anand Maria, and he has to move ahead. So we are always very happy to guide our dear students and go on with the publication.
Mm-hmm. Yes,
Yes,
thank you so much, sir. And one participant takes in the textbook about the plagiarism software. They call it Tunitin software to check the plagiarism. If any of you like want to go check that software, I'm sure it would be useful. And so let's move on to the next question.
Yes,
do your student in your university need to involve in any research during the course of their study?
yes, madam. We have many students who are involved. Even in the undergraduate, they have been doing the national level, the Indian Council of Medical Research, and students. We keep picking from the clinical students from the third BDS. Here the third BDS, but you have a 7 years program, but we have only the 5-year program. We start encouraging them since the third BDS, the clinical areas, as they enter into the clinics, and the third final year and the whole internship. During the internship, we encourage them to do the short studies and encourage for publications.
Mm-hmm. And so the next question is, can you have clarify once again about the review? How many types of review can we conduct and they are acceptable? What is the least rigorous review and most rigorous review? Thank you so much, Professor.
Madam, can you please ask the question once again? There was a break. Can you repeat the?
Yes, honestly, I have a hard time understand the question also, but it's in the text box. It's in the text box.
Anand can help, madam. Anand can help.
Basically,
Anand.
the question is on the types of reviews which are acceptable for publication in probably high impact journals, and which ones on the, I think probably based on the pyramid of evidence, which reviews are more rigorous and which are less rigorous.
Madam, this question, the right person to answer is Anand Maria. So he knows it thoroughly. And madam, of course, some rapid reviews or narrative reviews. Narrative reviews, they get accepted little early in the rapid reviews, and systematic reviews, it will take some time. Then you have, above that, you have the Cochrane reviews. So the narrative reviews and the selection of the journal, as I told you, and as all of you have seen, the Q1, Q2, Q3, Q4, and the selection of the journals. As you go to from the Q1, it will be more rigorous based on the Q1, Q2, Q3, Q4. That's why I added that in my presentation. So it will be more rigorous as you go up. So the number of reviews, corrections will be more.
Oh, I see, sir. Yes, thank you so much, Dr. Nan. You are lifesaver. So I missed one question. So if you can go back to those questions. So one question asked, sometimes students, especially in Key, I think, research is not important because probably they clinical oriented people. So what do you think are the advantage of learning how to do a research and carry out research, sir?
Research, Anand?
No,
so there's a question which was asked again, I think by Professor Callum. So
yes, please.
Asking about probably the mindset of students. So because sometimes students, especially in the undergraduate level, do not pay much attention to research, or they feel it's not so important. So according to you, what do you think are the advantages of getting into research and carrying out research?
Yes, Anand. Yeah, I got. Professor Callum, sir, actually, this, I mean, from the third year, as they enter the clinical areas, we should always, I keep motivating them during the undergraduate classes. I keep telling them, we need to tell them the benefits of research and how it is useful for them in their career. in the future. In the future, it is going to be the research is very, very important in the future. Already, I gave you one example yesterday. One of my house surgeon, young boy, is very innocent boy, and he just ran and he came and asked, sir, I want a publication. So, but publication, you need to work on that. That he doesn't know. So the publication, it will not come just like that. It cannot be gifted. The publications cannot be gifted just like that. So we need to tell them the importance for if they are when they are going for their higher studies also, it will be very, very useful. So all that has to be put into the student's mind. So then it will be very, very helpful, sir.
Yes, I totally agree with that.
Yes, sir.
It's especially for students who are looking to go into a masters to study abroad,
Yes.
or even for further studies. If they have some research which is published, it adds actually to
Definitely.
Yes, sir. It adds to
Yes,
the
sir.
CV, and it helps you get a scholarship much easier
Yes.
compared to somebody with no research. So
Yes, sir.
especially in foreign universities, they do prefer a lot of research background.
Yes.
Yes. So I think
Madam,
there's one more question by
yes,
Dr.
sir.
Emmanuel. Could you briefly explain some of the funding agencies which can support grants?
Grants, that is actually it is a separate topic as such. The grants, I didn't move into that area, the grants area. Okay.
Yes, sir. So the common ones are NIH, CDC.
Yes.
We have
CDC
a lot
and
of
NIH. Very
also.
true.
But
Very true. In India, ICMR, DST, all these things. DST, ICMR. These are the main funding agents in throughout the country.
I'm just checking if any more questions. If anyone has any other questions, please type here in the chat box and we can take it up.
Dr. Anand, if you don't mind, I would like to ask one question.
Yeah, sure, please.
Yes,
please.
madam.
So,
yes, madam.
how do we evaluate our research finding to go, to decide to which rank of journal should we submit to? Like, is Dr. Anand, does my question make sense to you?
Yes, sir.
Yes. Okay. Yes, sir.
Yes, sir.
Yes,
so Dr. Vitu wants to know, like, for example, we have a research. So how do you decide whether it is good for a high impact or a low impact journal, or what range of journal can we think of sending it to?
Yeah. That depends on we need to check the area of the work done in which area, and then based on that we need to select the clinical journal or the non-clinical journals, whatever based on the area of interest. Then we need to check for the journals.
Yes, sir, very true. I think that is one factor, and another factor would be the novelty factor of the research also.
Yes, exactly. So the novelty.
Yes, sir. If the research is is something very novel, then it has more chances of going into a high impact.
Yes.
But there equally it could go wrong also, because a novel approach is not very easily accepted. Right. So in a peer review, you have to consider a very high quality discussion. If you add a very high quality discussion, I think it's easier to go into a high impact journal.
Yes, Diana.
I see. Thank you so much, sir, for your answer. Thank you so much.
Thank you, madam. Thank you, madam.
Okay. So do we have any more question?
I think no more questions. So I would like to request the one answering the questions is Dr. Horn Rithvito. He's one of our well-known young researchers who's actively
excellent.
Yes,
excellent.
Yes, sir. So very good. Ask him to present a small token of our appreciation to you.
Yes, sir.
Okay, so can you see my screen now, Dr. Mandava?
Yes, madam. Yes,
okay, yes, sir.
Thank you.
We'd like
you so much.
to
Thank you so much.
you with a certificate of appreciation that you share us your valuable lecture for today, sir.
Yes, madam. Thank
Okay,
you.
and this
Thank you
will
so
be
much.
sent to your mail also, sir.
Yeah,
So
yeah, yes,
will be
madam.
clearer. Yes, sir.
So nice of you. Yes, ma'am.
Yes, sir. Okay, so Dr. Anand, do you have anything you would like to say before we come to the end of our session?
So I think this is probably one of the reasons why I requested Professor Prasad to just give us a lecture. I think this is something which should be of great interest to our students to engage in research. See, research may not bring in the kind of financial rewards that you think, but it does. I think for us as dentists and
Yes, ma'am. Yes, Anand.
medical professionals, I think it's very important to engage in research, because whatever we learn, I think it's all from research. So whether it's textbooks, those are also research based. Whatever we practice should be research based again. So I think we just published a new paper in which we've highlighted the importance of evidence based practice and scientific evidence based practice. So not just based on advertising or marketing claims. So that was one of the reasons, and I hope I'm very sure the students got a very valuable lesson on that, sir.
Very true, Anand. Very true.
So I would like to wholeheartedly thank you so much for taking out
Yeah.
time. Also for all our
Thank you,
faculty
Anand. Always.
students. So it's very
Always. Yes. Yes.
so nice of
We'll
you,
keep
sir, to take
meeting.
out time.
We'll keep meeting, Anand. We'll keep all of us.
Sure.
Yes.
So thank you, everyone.
Yes.
And thank you so much, Professor Prasad. So please have a good afternoon, and please stay safe, stay healthy, and hopefully we can all meet in person soon. So with
Yes,
that, I would like to bring this session to a close.
Yeah.
And
Best
thank you
wishes
so much.
for your lecture, Anand. Best
Yes,
wishes for your lecture.
thank you, sir. Thank you, sir.
Yeah.
Thank you so much, sir.
Yeah. Madam, yes.
Okay, goodbye, everybody. Goodbye, Dr. Anand. Goodbye, Dr. Mandava.
Yes.
See you. Yes,
Bye
yes, sir.
bye. Bye bye, doctor.